Hi guys, today we'll discuss one important condition called deep vein thrombosis. So what it means by thrombosis? Thrombosis is nothing but something obstructed in the veins. So usually thrombosis are of two types. One is superficial venous thrombosis, one more is deep venous thrombosis. As we know everything, there are some veins which are superficial to the body and which are deep to the body. So there are superficial, like there is no much complications for the superficial vein thrombosis because you just think that if the someone got on vein flow and if it is blocked, what it will cause? It will cause supervenous thrombosis. So there will be no maximum or there is no major complication from the superficial vein thrombosis. If it is occur superficial vein thrombosis, only patient will get swelling, tenderness and redness of this affected part, and there will be no any extra complications. And patient may get only extra complications like he may get fever with chills. So this is a superficial venous thrombosis that this is occur in mostly practice everywhere. So one more thing, I want to discuss some important condition that is it may cause life threatening problem like something called deep vein thrombosis. So what is meant by deep vein thrombosis? It is also called in short term DVT. Okay. So what is meant by deep vein? There are some veins which are deep to the body. Like if it is a mostly deep vein thrombosis affect the limbs, lower limbs. So in lower limbs, what will happen is because of the only I will discuss like everything there in textual wise. There is a theory part is there in book. So I want to discuss some very important concept which are very helpful for the practitioners. So what will I do is one more thing we'll discuss in a very short like interesting manner. So what will happen in case of deep vein thrombosis? Let's think that if the patient is having some limb here, okay, because you can see the limb. Okay, this is normal limb. If someone came complaining of only pain and swelling of this limb, only since like only unilateral pain, you just think that if the patient is having pain and swelling here, okay, of this whole part. So what are the differential diagnosis? But what are the DDs? Means differential diagnosis. First one there will be cellulitis. Next one there will be a myomitis. Next will be the deep vein thrombosis. So these are the only causes of unilateral swellings. So in case of cellulitis, there will be local inflammation of the cells. It will cause all the signs of inflammation to that affected part. So what are the signs of inflammation? You know that rubor, calodolor, that is nothing but a pain, swelling, tenderness, redness. And this will cause cellulitis. Only treatment for the cellulitis is you can, if you give an antibiotic, it will cellulitis will reduce very soonly. And one more is myomitis. So in some patient unilateral swelling, they may having severe tenderness, they may present with something muscle pain. So in this condition, even a simple steroids will cause reduce his pain. So these all are not having so much complications, but this DVT it may cause very important major complication. It may cause a pulmonary embolism. What is mean by embolism? Embolism I will discuss in a whole, like how if you take a camera will zoom, no, in the same way I will zoom here. So I want to if it is a DVT case, I want to zoom here. So what will happen to this part? So you can see, so this is a major part, this is limb, and this is a vessel here. Okay, because of this is a limb part and this is a vessel, that is vein, nothing but a vein. You just think that it's a vein. So what happened in this vein? Again we'll zoom here, this part. You just think that this is a vein. So because of three conditions which is come under like you can call as varicose triad. Varicose triad. What is meant by varicose triad? Varicose triad nothing but if it is, you can see this varicose triad. One is stasis, hypercoagulopathy, one more is vascular damage. Just think that I want to tell in हिंदी. So अभी कोई पेशेंट को अगर जो भी वेसल्स में ऐसा डीवीटी बनाने के क्या चाहिए, अभी जस्ट थिंक दैट दिस इज एन वेसल वेन, इसमें क्या चाहिए? इसमें कुछ तो थ्रोम्बस होने के लिए कुछ तो बनाना चाहिए. फर्स्ट क्या रहता है? स्टेसिस. स्टेसिस मतलब देयर विल बी अ मिनिमम व्हाट because of all these three conditions, there will be formation of deep vein thrombosis. Means if it is there, means there will be definitely this will form a deep vein thrombosis. Like you just think that if any person will get some hit or cut to this part body, you can see this. If the veins were cut here, so what will happen inside the vein? There is a blood and there will be huge platelet aggregation. There will be platelet collection here. Because of this platelet collection, there will be a stasis of the blood. So this is come now, stasis of the blood, and because of there are some patients who are more prone to hypercoagulability. If the patient is having smoker history, the blood is more more little or hypercoagulability. You can see there is a vascular damage, the formation of stasis of the blood, and there is a hypercoagulability. So this condition will cause a deep vein thrombosis. As there is a venous thrombosis here, the affected part जो भी आगे का रहता है ना, जो वेसल सब बंद होता है, इसलिए क्या होता है जो भी इधर कलेक्ट हुआ है ना, it will cause a pain, inflammation, swelling. So it will patient को because of this venous collection limb edema होता है. So it will cause severe edema of the limb. It will cause this condition is called as a deep vein thrombosis. You can see यानी सिंपल करना है, जो भी पेशेंट स्वेलिंग आते हैं मिडल एडिमा कुछ तो आता है, यूनिलैटरल स्वेलिंग. सो यूनिलैटरल स्वेलिंग है तो ये सेलुलाइटिस है क्या, मायोमाइटिस है, एनी अदर फ्रैक्चर है. इन सम पेशेंट इवन अ फ्रैक्चर विल कॉज स्वेलिंग. सो हाउ टू डिफरेंशिएट द पेशेंट हैविंग फ्रैक्चर और नॉट? इफ इट इज अ फ्रैक्चर, sudden onset of history of cell fall may be there, any RTA cases may be there, and if you take an X-ray, there will be fracture obviously seen, that will cause swelling. And one more patient is, if the patient is having cellulitis, cellulitis means patient will have some fever, tenderness, rigors with mild, all the signs of inflammation to that affected part. If it is there, means that is a cellulitis. How to identify the DVT? You can see only pathologies. There will be a venous traces, varicose triad. It's not triad, it's a triad. So this, if it is there, means there will form a definitely this will cause some venous thrombosis. It will cause DVT. So what are the causes of DVT? First we will discuss here. What are the causes? Causes can be remembered with the name called thrombosis. Okay. Thrombosis means first letter is 3. T means travel. So the patient is having, some of the patient there will be more, they will get जो भी पेशेंट हेलीकॉप्टर में, विमान में सर ट्रैवलिंग करते हैं ना, लॉन्ग स्टैंडिंग अफेक्टेड, लाइक क्रॉनिक 12 to 48 आवर्स ट्रैवलिंग वगैरह करते हैं एरोप्लेन में, इन दिस पेशेंट देयर विल बी अ चांसेस ऑफ थ्रोम्बोसिस ऑफ द वेन बिकॉज ऑफ लैंड स्टैंडिंग इमोबिलाइजेशन. इट विल कॉज एन वेनस थ्रोम्बोसिस. दिस इज अ ट्रैवल. वन मोर H, नथिंग बट हार्मोनल थेरेपी. What is meant by hormonal therapy? Oral contraceptives, OCPs. Some female patients they will take in OCP. It may cause a thrombosis because of the hypercoagulopathy. One more thing is R. R means RTA cases. If the patient is having any RTA cases, there will be no bone fracture. But as the patient is any hit, there will maybe you can see this. There may be a break-up vessel. It will cause stasis of the blood and it may cause a thrombosis. There may be chances. Next one is operation. O means operation. What are the operations? In patient of any hip fracture operations, any surgery like cesarean section, any post-operative period, there will be a long standing, they will take rest without any immobilization. If the patient is having any gastrojejunostomy, any operation, laparotomy, anything, so if the patient is having a chronic like more than 5 days or 3 days, they will take rest because of the chronic stasis. There will be again stasis, hypercoagulopathy and vascular damage will cause DVT. And next is M. M is nothing but there are some malignant conditions. What do you mean by malignant condition? There are some CA conditions which may affect to the vessels like blood. It may be a blood CA, it may be any other CA. In pancreatic CA there will be or any other liver cancerous condition. It may cause severe like blood clotting factors may be affected, and because of this condition they will cause a thrombosis, deep vein thrombosis. Next one is B. B means there are some there are some patient who was very like blood disorders. If they are having some clotting factors in the blood, there are whichever the blood clotting factors. If any problem in that blood clotting factors, you can see the blood clotting factors, or you can broadly call it as blood disorders. Next one is O. O means obesity and old age. Patient is having huge obesity may cause, and old age people may get. Next one is yes. Yes means there are some smokers. Smokers will get more affected as the patient is having chronic smoke. It will cause a severe like all these conditions, stasis, when hypercoagulopathy station. Smoking will cause hypercoagulopathy, and in turn it will cause a deep vein thrombosis. And what is meant by I? There are some inherited conditions like from before birth only they will get some blood disorders. Last one is yes, this is a very splenectomy. There are patients, some of the patients who are operated for splenectomy. You know that spleen is a graveyard for the red blood cells. Because of this condition, the patient may have all this DVT. So these are the causes, and we'll discuss some signs now, signs and symptoms. You know how it will occur. You have seen that every patient will get because of the long thrombosis, then there is varicose triad. You can remember this will come for exam also. Varicose triad is nothing but stasis, hypercoagulopathy, and the vascular damage. This is a pathology. What are the signs and symptoms? Signs. You know there is one thing, some test called Homan's test. Homan's sign. You can see the call as a sign. So what is meant by Homan's sign? Homan's sign is that if the patient affected part, if the patient have any dorsiflexion of the foot, if the patient is having any dorsiflexion of the foot, it will cause severe pain. Means dorsiflexion flexion of foot cause pain. So this is one test, but this should not be done. Why they are called that this should not be done? It will cause an, if the patient, let's see that if the patient is having and some clot is there here. If the patient, this is a limb, and you will just think that this is a limb now. Yeah, yes. Hyperflexion means we have to flex this. We have to press like this. This is a foot. If you press means there will be a pain occur because of there will be a thrombosis there here. There will be a blockage. Because of this blockage, Homan's sign, if you dorsiflex the foot, it will cause a pain. Yes, if you do any squeezing dorsiflexion, there will be chances of there is thromboembolism. Embolism means there will be clot will dislodge. It will take वो क्या होता है इधर से बाहर जाके from femoral vein, from the femoral artery, from the carotid, it may cause a severe one important condition called, it may goes to the lung called cause pulmonary embolism. Simple. Homer signs, if the patient have any muscle pain, because of this condition, this clot will directly goes to the lung. This is a lung. So as it directly goes to the lung, it will cause pulmonary embolism. So lungs में मतलब क्या है, lungs में जाके जो भी pulmonary vessels रहते हैं उसमें भी block करता है. So if it is there means, if any blockage in the pulmonary vessel, it directly called as pulmonary embolism. So pulmonary embolism, you know that it's a life-threatening problem. It will directly cause a death. So what are the signs of pulmonary embolism? If any patient of DVT during someone has squeezed his muscle and everything, sudden onset of cough, cold, sudden onset of very cough, breathlessness, and raised JVP with hypotension, severe sweating. If it is there means we have to think that maybe a pulmonary embolism, maybe dislodgement of this that blockage part, clotted part may be dislodged, goes to the lung vessel, and it may be got a pulmonary embolism. You have to suspect like this. And this is the Homan sign. So clinically symptoms, patient will present unilateral swelling. So symptom wise, unilateral swelling on examination will cause redness, tenderness, and the pain. So these are the conditions. So we'll discuss a final now. What is the treatment? So if you have, what will the treatment? Treatment is nothing but, you can see this. What happened here? There may be a blood clot here. So we have to remove this clot. How to remove? We have to give some blood thinners. There's something called as heparin and warfarin. So what are these? These two are anticoagulant. Anticoagulant, nothing but blood thinners. So these two are the anticoagulants. What happened? You know DVT pathology. It will have, there will be a blockage here. So how to break this blockage? It will break by, you can give an anticoagulant medicines like heparin and warfarin to be given. After giving, there will be chances of dilution. You can see there will be chances of dilution and the vessel will become normal. Patient will get relief. So this is a pathology. So what you have to do? Like heparin, why both? Because heparin actions will be immediate action, and warfarin will be not, it's not immediate, it will take minimum 8 days to act. So for chronically, the patient may have years together this thrombo like anticoagulants to be taken, like warfarin to be taken years together. That's why in patient, if you have clot, so immediately you have to remove this clot by giving heparin with warfarin. So like heparin and warfarin accelerate. What is meant by acceleration? हेपेरिन अभी जो भी देना है हेपेरिन उसको एक्शन इमीडिएटली स्टार्ट होता है, लेकिन वारफारिन का एक्शन 8 डेज के बाद स्टार्ट होता है. सो दोनों एक ही साथ में स्टार्ट करना चाहिए, ताकि हेपेरिन का 8 डेज, जब तक 8 डेज स्टार्ट होता है ना, तब तक यू हैव टू कंटिन्यू द हेपेरिन. मीन्स इट हैव टू ओवरलैप दिस कंडीशन. वारफारिन टू बी गिवन फॉर 8 डेज, till warfarin action takes place, you have to continue the heparin for the 8 days. Once you have to give once we have given heparin for 8 days, we have to stop the heparin and you have to continue the warfarin for the for to be continued for years together. So only one investigation what you have to do is PTINR. We have to maintain 2 to 3 PTINR every time. We have to monitor PTINR by giving warfarin every time. So this is a treatment. Other we have is it will cause some inflammation and everything. For this inflammation everything, you have to give some anti-inflammatory medicines, painkillers, anything to be given. Only thing is DVT. It is having some stasis. Varicose triad is there, stasis, hypercoagulopathy, and one more is vascular damage. Because of all this varicose triad, you can see varicose triad nothing but stasis, hypercoagulopathy, and vascular damage. So because of all these conditions, there will be a blockage in the cord. It will cause a DVT. So this is a DVT lecture, and we are having one important same patient we are having. So we will discuss that. Thank you.